For years, we've all heard the same thing about blood pressure. The lower, the better. Simple as that. But what if that whole story is wrong? And not just wrong, but actually dangerously wrong for people over the age of 75. Well, a major new study is suggesting that as our bodies age, our medical goals need to change right along with them. And it turns out chasing that perfect blood pressure number might be putting older adults in harm's way. It sounds totally backwards, doesn't it? I mean, we've had the lower is better idea drilled into our heads for decades. But the latest science is really forcing us to ask this critical question. So we're going to unpack the answer, and trust me, it is surprising. It all kicks off with one pretty startling statistic.
Okay, so let's just focus on this number for a second. A study in the Journal of the American Medical Association, a really big deal, found that seniors who had what we thought was perfect blood pressure, a systolic reading below 120, they actually had a 28% higher risk of serious falls, the kind that land you in the hospital. And not only that, but their overall mortality rate was higher too. So what in the world is going on here? And this all brings us to what we can now pretty much call the perfect pressure myth. The whole idea that one single blood pressure number is the gold standard for everybody is, well, it's being completely taken apart by the science, especially when we start looking at the unique biology of an older body. Now, let's be absolutely crystal clear about something. For folks in their 40s, their 50s, aggressively getting that blood pressure down is vital. It's one of the best things you can do to prevent heart attacks and strokes down the line. The evidence on that is rock solid. But once you pass age 75 or so, your body starts playing by a completely different set of rules. Okay, so why? Why does the story flip so dramatically? Well, it really comes down to three fundamental things that change in our bodies as we get older. And if you can understand these, you'll see exactly why our health targets have to adapt right along with us. First thing on the list is something called arterial stiffness. The best way to think about it is like this. Picture a brand new, flexible garden hose. Now picture that same hose after it's been sitting out in the sun for 20 years. It's stiff, it's kind of brittle. Our arteries do something very similar. And when they lose that flex, the heart actually needs to pump with a little more force, a little more pressure, just to make sure enough blood gets all the way up to the brain, especially when we stand up. Next up are baroreceptors. These are these amazing little sensors inside our blood vessels that are constantly monitoring pressure. In a younger person, you stand up, they react in a split second, and you feel totally fine. But as we age, they get a little sluggish. Their reaction time slows down. So if your baseline pressure is already being pushed way down by medication, that slow reaction can cause a really dangerous drop in pressure when you change your posture. And the third piece of the puzzle is all about how we handle medication. You see, the body's systems for clearing drugs out, our kidneys, our liver, they just aren't as zippy at 75 as they were at 45. And what that means is a dose that's perfectly fine for a middle-aged person can actually be way too much for an older adult. It just hangs around in the system longer, pushing that blood pressure down too far, for too long. So we've talked about the theory, right? The why an older body needs a different approach. But what does the hard data actually tell us? For that, let's go back to that huge JAMA Internal Medicine study. They tracked thousands of older adults to see what really happens at different blood pressure levels. Now, this is where it gets really interesting. Just take a look at the story this table tells. You see that top row, the group with that perfect pressure, below 120, there's that 28% higher fall risk and a 14% higher chance of death. But the real headline is right there in the middle, the part that's highlighted. The lowest death rate, what they called the sweet spot for both safety and for living longer, was actually in the 130 to 140 range. It just shows so clearly that for older adults, too low can be every bit as dangerous as too high. All this research really points to a common but often missed danger. It's something that doesn't always show up in a quick visit to the doctor's office. It's what happens in those quiet moments when you're just going about your day at home. I mean, how many people have felt this? That little bit of lightheadedness when you get up from a chair too quickly. It is so easy to just brush it off. Or for a doctor to say, oh, that's just part of getting older. But what this new research is screaming is that feeling, which has a medical name, it's called orthostatic hypotension, could actually be a critical warning sign that your blood pressure is dropping way too low when you're on your feet. But here's the really great news. There's a simple and really powerful test you can do all by yourself, right at home, to see if this is happening to you. It's called an orthostatic vital sign measurement, and it can give you some incredibly important information to share with your doctor. Okay, so here's exactly what you do. It's super easy. First, just lie down and chill out for about 5 minutes. Then, while you're still lying down, take your blood pressure. Write down those numbers. Okay, now stand up, and as quickly as you safely can, take it again while you're standing. Now you just compare the two readings. If that top number, the systolic one, dropped by more than 20 points, that's a red flag. That is a clear sign that you need to have a conversation with your doctor.
All right, so with all this new info, what's the real bottom line? The goal here isn't to just ignore your blood pressure, not at all. The goal is to make the target personal. It's all about working with your doctor to build an action plan that is right for your body. This table right here gives you a new, science-backed way to think about that conversation. Just notice how the suggested targets gently creep up with age. For a healthy 80-year-old, somewhere between 135 and 145 might be the absolute safest place to be. For someone over 85, or maybe someone who's a bit more frail, even 140 to 150 could be the perfect range. Now look, these aren't rigid rules, but they are an excellent starting point for that discussion. So here's your game plan. The whole point of this is to become an active, informed partner in your own health. So get a home monitor. Keep a log for just a couple of weeks. Do that orthostatic test we talked about, and then with all that data in your hand and any symptoms you've noticed, make an appointment specifically to talk about your personal blood pressure target with your doctor. And at the end of the day, all of this really boils down to one final, really powerful question you should ask yourself. As our understanding of the human body gets better and better, we all have to wonder, are my health goals based on some outdated one-size-fits-all number from a textbook, or are they truly built for my individual age, my body, and my life? The answer could honestly make all the difference.